Welcome to Health Professional Radio. Thank you so much for joining us. I'm your host, Neal Howard. Now, according to the American Cancer Society, every year more people die of lung cancer than of colon, breast cancer, and prostate cancers combined. Our guest is Dr. Howard West, Medical Director of Thoracic Oncology Program at the Swedish Cancer Institute. And he's joining us today to talk about some scientific advancements that are transforming our understanding of non-small cell lung cancer during this Lung Cancer Awareness Month. Welcome to the program, Dr. West, and thank you for joining us.
Well, thank you for having me.
Now, give our listeners just a bit of background about yourself, other than, as I mentioned, Medical Director of Thoracic Oncology there at the Swedish Cancer Institute.
I have been a medical oncologist since finished my training around 2001 and have been focused on lung cancer as my primary clinical interest since that time. I do some other things, particularly genitourinary oncology as a secondary focus, but lung cancer has been where I spend the most of my time, and I see patients about 3 to 4 days a week and run a bunch of clinical trials and speak around the country, sometimes other parts of the world, just talking about the newest developments in a rapidly changing field of thoracic oncology.
So non-small cell lung cancer, hearing a lot about it, especially during this month in media. What is non-small cell lung cancer, and does it differ from any type of other lung cancer?
Yeah, so unfortunately, cancer and oncology often does too much defining by what things are not. Things like we have non-Hodgkin lymphoma and Hodgkin lymphoma and small cell and non-small cell. They could potentially have just called it large cell, but the basic breakdown of lung cancer is in terms of small cell and non-small cell lung cancer based on primarily how they look under a microscope when you get a biopsy. But they also correlate with different clinical behavior and response to treatment. So you manage them differently. In our management, we give chemotherapy as the cornerstone for patients with small cell, and we also do surgery, chemo and radiation, and sometimes whole body or systemic therapies to patients with non-small cell. In the U.S., small cell is about 13% of all the cancer out there, and non-small cell constitutes the majority, about 87%. They also differ in that small cell is much more closely associated with smoking, though smoking is associated with lung cancer in general. There are a significant fraction of patients with non-small cell in particular who have never smoked or who gave up smoking decades ago. In fact, never smoker lung cancer would be in the top 10 most common types of cancer if it was a separate entity. But most people don't appreciate that and think of this as just, it's a smoker disease. And I think that's part of why it gets less attention and so much stigma, which is a terrible problem that has dogged the field.
How many folks would you say are dealing with this non-small cell lung cancer or lung cancer in general, not only here in the United States, but worldwide?
Well, in the world, it's in the millions, over 1 million in the world diagnosed with lung cancer every year. In the United States, it's about 220,000 people diagnosed with lung cancer in the U.S., and unfortunately, over 150,000 deaths. And so that makes it the most common cause of cancer death, as you mentioned, in the United States, more than the second, third, and fourth combined. But a lot of people don't appreciate that, and it's 28% of cancer deaths in men and women, and yet it gets incredibly less funding for clinical research compared to breast cancer and others, I think largely because of the stigma associated with it, unfortunately.
Now, you've teamed up with a company in order to, as you say, get the word out, because there is so little known and the funding isn't up to par as is needed to be. Talk about this initiative, ALK-Positive.
So ALK-Positive is really focused on the ALK-positive patients. Now, ALK is what we call a driver mutation, and that tends to be associated with the probability with having a specific mutation that is the main driver of a cancer. And in the United States, about 15 to 20% of patients with lung cancer have a driver mutation. One is called ALK, another is called EGFR, and there's a few other markers. And when they are present, you don't need to have what is usually the case to develop cancer, which is a collection of many mutations, each contributing a little. And that tends to be the more common finding in the cancers that are associated with smoking for many years. In contrast, the patients with driver mutations are often typically younger and often have no smoking history or a minimal and remote smoking history that is probably just incidental and coincidental. And so the other important practical thing is when people have one of these driver mutations, we have in many cases a specific targeted therapy that is a pill that can be very effective, not curative, unfortunately, but can last for a year or several years. And increasingly, there are a few different targeted therapies that can be used in succession, so that we have transitioned from even advanced or metastatic lung cancer historically being a disease associated with a median overall survival of less than a year, several months, to now being one that we routinely expect and see patients living for years with. And it's turned it into a much more chronic disease, which is certainly a major step in the right direction for people who now can go 2 or 3 or 4 or more years just taking a daily pill or a few pills to live their lives normally.
It's Takeda Oncology that has launched this initiative. Am I correct?
Yes. So it is Takeda, and I'm just somebody who sees and treats a lot of patients with ALK-positive disease, and so this particular campaign is really focused on two things. One, it is to get the word out, giving portraits of patients, basically getting their stories out for those who have ALK-positive disease, which I hope will provide a great deal of encouragement and hope for other patients to know what's possible, to see patients who are living their lives for years and doing well. So part of it is the patient stories aspect, and part is the general awareness of the disease state of what is ALK-positive lung cancer, who are the patients affected by it, and what are the treatment options for them. So under the rubric of Lung Cancer Awareness Month overall, this specific campaign and even a dedicated day focused to ALK-positive patients who amazingly are finding each other online and becoming incredibly educated about their diseases and can become empowered participants in their own care from what they learn if they're given access to good enough information. I also run a cancer education nonprofit called GRACE, Global Resource for Advancing Cancer Education, that is really dedicated to providing highly credible, timely, free information to patients and caregivers around the world so that everyone can know what the lung cancer experts would do and why, regardless of where you are.
And where can we go online and get some more information about this initiative?
For GRACE, it's cancergrace.org. For the specific talk campaign on ALK-Positive, livingwithalk.com/talkpositive. It's also information at ALK-Connect, ALK-Connect.com.
I appreciate you coming in. Dr. Howard West, Medical Director, Thoracic Oncology Program at the Swedish Cancer Institute. Hoping you'll come back and talk with us in the future.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.